Yeah, so this is the referral I got from the doctor. It says I have impingement syndrome, but I don't really know what that means.
Okay. Yeah. It's very common. We'll kind of chat about that a little bit and just want to do some testing first, rule out some stuff, then we'll bring it back together at the end, okay? So, good news, we're able to rule out anything kind of scary, and I think it's time for us to get to work.
Okay, but what's your thoughts on what exactly is going on?
I'm glad you asked. So the doctor's script, called it quote unquote impingement. I don't love that word just because I feel like it kind of creates this like fear of like every time I move my shoulder like that, it's impinging on tissues. It's really more of this like symptomatic type of quote unquote impingement at end ranges, which is super common and not necessarily a dangerous or bad thing. And we know that we can manage it really well conservatively.
Okay, so what do you think in my case is getting impinged?
Yeah, so another great question. There's a lot of structures around the shoulder. So honestly, if anyone were to give you like the one exact thing that's getting impinged, not sure I'd be buying that. However, I'd be more than happy to kind of walk you through a couple of the different structures I think could potentially be involved. But biggest thing I want you to understand is that ultimately, whatever it could be, doesn't necessarily change how we're going to get you back to kicking some butt and lifting weights.
Okay, I'm for that. But what about my shoulder blade? The doctor kept saying it was doing something funky and it wasn't tracking right. How does that come into play?
Yeah, so, that's another great question, and honestly, like another thing that kind of has this like cloud of uncertainty around it, what we found is that, when we try to correct these movement patterns of the shoulder blade, people do get better, but the patterns don't really change. So it's more about just kind of having this like comprehensive program that we're gonna have together that includes some of these exercises. But less about like this need to correct the perfect pattern, more about just like working together to figure out entry points to getting that shoulder loaded, building up some great comprehensive capacity, and getting you back to sport.
Okay, yeah, because I need to lift.
Yeah, we're gonna fucking crush it. Embracing uncertainty in clinical practice is really hard. We know that patients are coming in and they want these very clear-cut diagnoses and prognoses. So do we have all the answers for this? Definitely not. It's really hard and it's going to be different for every single person. But here's a great piece of advice for getting started. Really dive into the literature surrounding contemporary rehab and things like impingement. Because, I can tell you that when you really know your stuff and you have a good foundational understanding of the nuance of this, it's going to allow you to go into these conversations with so much more conviction and confidence. And that goes a long way in building therapeutic alliance with your patients. And not everyone's gonna need these like messy, complex conversations about the nuances of impingement. But knowing your stuff is still gonna help you kind of sort through, but you gotta read the situation, know when it's appropriate, but ultimately it's on us to really reflect what's current best evidence and lead by example.